Typhoid fever is a serious bacterial infection caused by Salmonella enterica serotype Typhi. The disease has a long history, with its first detailed documentation dating back to the 19th century. It was British scientist Sir William Budd who first linked the disease to contaminated water in 1873, and by 1880, German pathologist Karl Ebert discovered the bacterium responsible for the illness. Typhoid fever spreads through contaminated food and water and primarily affects populations in areas with poor sanitation. Unlike other diseases that can spread through multiple vectors, typhoid is strictly transmitted by ingestion of bacteria from contaminated sources. It is most common in parts of Asia, Africa, and Latin America, where water supply and hygiene infrastructure are inadequate. Typhoid fever can present in two main types: typhoid fever caused by Salmonella Typhi and paratyphoid fever caused by Salmonella paratyphi, which generally causes a milder illness but has similar modes of transmission and symptoms. Once infected, the symptoms of typhoid fever usually develop within 1 to 3 weeks. Initial symptoms include high fever, headache, stomach pain, and weakness. As the disease progresses, patients may experience diarrhea or constipation, loss of appetite, and a rash of flat, rose-colored spots on the abdomen. In severe cases, typhoid fever can cause complications such as intestinal bleeding or perforation, which can be life-threatening if not treated promptly. Globally, typhoid fever remains a significant public health concern. According to the World Health Organization, there are approximately 11 to 20 million cases and up to 161,000 deaths each year. The highest burden of typhoid is found in South Asia, where it is a leading cause of illness, particularly in children. Outbreaks also occur in regions of Africa and Latin America, especially in areas with limited access to clean water and sanitation. The global impact of typhoid is exacerbated by the emergence of antibiotic-resistant strains, making it harder to treat in certain regions. Multi-drug-resistant strains of Salmonella Typhi have been reported, especially in parts of South Asia, complicating efforts to manage the disease. When it comes to treatment, antibiotics are the primary method of addressing typhoid fever. Common antibiotics include ciprofloxacin and azithromycin. However, the growing issue of antibiotic resistance has led to the development of newer drugs, such as ceftriaxone, to combat resistant strains. Early diagnosis and prompt treatment are essential in preventing serious complications. Patients with severe cases may require hospitalization for intravenous antibiotics and fluids to prevent dehydration. Prevention is key to controlling the spread of typhoid fever. Vaccination plays a vital role, especially for travelers visiting high-risk areas. There are two main vaccines available: the oral live attenuated vaccine and the injectable conjugate vaccine. Both provide protection, but they are not 100% effective, so it's important to combine vaccination with other preventive measures, like drinking safe water and practicing good hygiene. On a broader scale, improving sanitation infrastructure and ensuring access to clean water are critical in reducing the spread of typhoid. In many developing countries, public health campaigns focus on raising awareness about hygiene practices, like hand washing with soap and boiling water before consumption, to curb the incidence of the disease. In conclusion, typhoid fever remains a global health challenge, especially in areas with poor sanitation. While vaccines and antibiotics can control the disease, the key to long-term prevention lies in improving access to clean water and sanitation. With continued efforts in public health, vaccination campaigns, and advancements in treatment, we can reduce the impact of typhoid fever and protect vulnerable communities around the world.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.